Okay. I'm recording.
Hi, my name's Paula Nutting and I'm your musculoskeletal therapist, and today what I'm doing is showing you some techniques that you can use to improve the body function and the overall well-being of your client. So this is Lizzie, she's helping me today, and we're looking at pelvic rotations or muscle energy techniques specifically for the sacroiliac joint and the connection between the lumbar and the sacrum. So first of all, we need to establish what's going on with Liz and what kind of pelvic mobility she's got. So Liz, I'm going to get you just to let your legs roll, and I'm looking for the integrity of what's going on through the thoracic mobility, through the lumbar, and how far her knees can go down, and get a subjective analysis. Okay, bring them up, Liz. And you'll notice that I'm pinning down the opposite shoulder so that she stays still. Let them roll down this way. And as you can probably see, she's much stiffer through here, and we're getting a background because the knees aren't getting anywhere down as far as they probably should. So that assessment to me says I need to release this side because this side's quite loose. So the way we're going to release this side is through a technique called muscle energy techniques, which was designed originally by Leon Chatow and a few other people, but that's neither here nor there. I position myself so that my leg is going to allow Lizzie to rest her legs on it, so she's now in a relaxed state. And we want to make these muscles contract, and what that does is it performs a reciprocal inhibition. So I'm going to pin down her pelvis, or sorry, pin up her pelvis, pin down her ribs, lock my arm in, and Liz, what I'm going to get you to do is you're going to pull both knees towards this leg, so you're going to be pulling that way at about 50% effort. So she's pulling about half of her strength. Push your right knee into your left. Some of the tricks that they do is they may forget to use the second leg, and she's pulling for about 10 seconds. Okay, little breath in and relax your legs on me. So this time now is the time when the muscles are going to soften off. We're going to increase that by gently rocking, so locking hips and ribs and pulling up. How are you feeling? Good? Okay. Let's apply that technique again. Okay, so pulling for me, both knees nice and firm, about 60% now, so a little stronger each time. Push that right leg into the left, don't be lazy. Big breath in and relax as you breathe out. So it's always good to get an exhalation breath when they relax. There's some theories behind that assisting in the stretch. Everything we do with muscle energy techniques is normally 3 to 1. So we always do 3 and then we reassess. How are you feeling? Okay, one more time. Pull nice and firm for me. So we're making sure that she's using her legs, not her upper body. If she was using too much shoulder, I'd tell her not to be pushing so hard. She needs to push that right knee into the left a little more. Big breath in and relax. Good. So we've done 3, giving it a rock, and now it's time to reassess. So what we should get out of this, okay, let the legs roll away from me again. We knew this was going to be fine, and in actual fact, look how much further it's got. And we haven't actually done treatment on this side. Bringing it up, let them roll towards me. Okay, so that's much further than it was the first time. Not as good as the other side, but it's still pretty good. And I'll show you other little tricks and tips to come into this Iliacus on another video. Thanks.